I'd like to introduce myself. My name is Bill Patjane. I'm the Executive Director for the APDA based here in Boston, Massachusetts. And I'd like to welcome everybody to today's presentation, Spring into Exercise, Put Your Best Foot Forward. I'm very excited about today's presentation because we have the opportunity for some incredible people in and around exercise and physical therapy to present on, activity. And the APDA is really enthusiastic and appreciates the opportunity to work with the National Rehabilitation Resource Center here at BU. And today's presenters are three incredibly experienced and credentialed individuals in and around physical therapy and exercise. And those individuals are on this screen: Tim, Teresa, and Tami. And so we're really looking forward to this presentation today. Additionally, we're going to record it and put it up on our YouTube page. And so if you have anybody that is interested in this information, we'll be sharing it after today's presentation. Along the way, if you have any questions, just put those either in the Q&A section or in the chat section. And at the very end, we'll be answering all those questions for you. Thank you. So if you can move the slide forward. So today, I want to just give an overview of the APDA. The APDA of Massachusetts has been in operation for decades and offers programs and services to the BD community, not only in Massachusetts, but surrounding states. We've received a large response for this presentation. A couple of additional things. There have been tremendous progress in and around understanding and treating Parkinson's disease. As you may know, Parkinson's disease is highly individualized from person to person, and not all that is discussed today is relevant to everyone. It's really important to put a healthcare team together that understands the signs and symptoms of Parkinson's disease, along with treatment strategies and how Parkinson's disease impacts the individual patients. Treating Parkinson's disease requires a team approach. Today, we are providing information, general information, and this is not intended as medical advice, just to be clear. Thank you. If you could go to the next slide. In Massachusetts, we have an information and referral center that is at the Boston University Medical Campus. The phone number is 617-638-8466. We do referrals and we provide resources to anybody that needs help in trying to find any activities or any sort of support. We provide education and support here in Massachusetts. We have support groups, symposium, and educational events. I know that there are a couple of individuals on today's Zoom from across the country. The repository of all the information is at the apdamain.org site if you have any questions or want any additional information. We also provide health and wellness, exercise and movement classes, dance, yoga, tai chi, boxing, fitness professional training program, and of course we have the APDA National Rehabilitation Resource Center, and they're presenting today. Thank you. Next slide. This gives an overview of how APDA works. We have our national office, Staten Island, New York, and these are the different dynamic components of what we do. Here in Massachusetts, we have National Resource Center for Rehabilitation at Sargent College at BU. We have APDA Advanced Center of Research at Boston University School of Medicine, and the APDA Advanced Center of Research at Brigham and Women's Hospital. Thank you. Next slide. And these are the two advanced centers of research. Thank you. Next slide. So I'd like to actually turn it over to Tim Nordahl, who is our next presenter. Thank you, Tim. And
hello, everyone. So for our talk today, I'll be speaking with a couple of my other colleagues at the Center for Neurorehab at Boston University. We each have sort of one aspect of an exercise program and some tips that you can think about for helping you stay on top of an exercise program or get started with an exercise program as we all look forward to the warmer weather to come. So Teresa, if you could send to the next slide for me. My part of today's talk is to be going over some tips for how to start a walking program. And if we can go ahead to the next slide. The first thing that I'd like to talk about is just why is walking important in the first place? I think it's worth spending some time going over this. As Bill had mentioned earlier, and I think this is really important to emphasize, everyone with PD is unique and has different needs. But this one exercise, walking, should be some component of just about everyone's exercise program. You know, it can be really important for different reasons for different people. The first benefit, physical activity, you know, even more generally speaking, can have many benefits for your health. You can think things like your blood pressure, sleep, your mood, and it can also help with many of your Parkinson's symptoms. There isn't any one right way to exercise, but walking is one way that you could work this physical activity into your weekly routine. Another advantage to using walking as part of your exercise program is that it is very accessible. You don't need to go buy expensive equipment or get a gym membership. All you need is a good pair of shoes. And as we look ahead to the spring, which, you know, hopefully it'll start feeling like spring any day now. I'm sure that many of you, like me, are looking forward to being outside again. And if you're admiring a beautiful spring day, why not get out and enjoy it with a little walk? You can also maintain more social distancing while you're out for a walk than may be possible in some other indoor exercise settings, which may be another selling point for us as we wait for the COVID pandemic to improve. So that's another reason that you could consider walking as part of your routine. And then if we could advance to the next slide. Another aspect that walking can help you with is your walking quality. So in addition to getting your regular exercise, we've found that when we ask people with Parkinson's what their goals are for working with a physical therapist, maintaining their walking ability is a top priority that our patients have identified time and time again. If it's not their main goal, it's within the top few goals that they have for working with a physical therapist. The latest research on motor training tells us that the best exercise for walking is walking. So if you're out for a walk, you can think of this as you're practicing an important motor skill while you're getting your exercise done. So I took this diagram out of a study. This is meant to show you what a normal walking pattern would look like. Parkinson's disease can have a few different effects on someone's walking pattern. So you might find that you're taking smaller steps, or maybe your foot scuffs as you pull your foot forward to take a step. You might find that you're leaning forward as you walk, or one or both of your arms won't swing naturally, like the diagram here. If you're able to get out for a walk and try to really concentrate on whichever of these issues you're having, for example, you can think about landing on your heel and taking bigger steps as you walk, you'll likely be able to make some improvements in your walking pattern with enough practice. Teresa, if you could go ahead and advance to the next slide for me. Another thing to think about is your walking pace. So We know that if you're walking a bit faster, that can oftentimes help you actually maintain your longer steps over time. And actually the faster pace helps to improve your walking pattern a little bit up to a certain point as well. You can also, walking faster will make sure that you're getting a little bit better exercise out of the walk because you're keeping a faster pace and getting that blood flowing. Now, a lot of my patients find that if they're focusing on walking faster, they can keep that going for a minute or two, but eventually we all lose our focus and you might start to slow down over time. So in other words, it's not necessarily hard for people to start walking at a faster pace. It's hard for them to keep walking at a faster pace. And I have a few tricks up my sleeve that can help you maintain that faster pace. In our clinic, we'll oftentimes use a metronome smartphone app that can help you maintain your pace. There are a bunch of free options, and as far as I know, they all work just about the same. So this is just again an example of one of the free apps that are available online. This is available from the Apple App Store. It's called Pro Metronome. The idea is you would start by walking at your comfortable pace, and maybe you can count how many steps you're taking over the course of a minute, and that's your cadence. If it's hard for you to count and walk at the same time, you can also use this button at the bottom. Teresa, if you could click for me. That button at the bottom, if you tap as you step, it will tell you what your pace is. So you can change the pace by tapping on this next area. If you could click again for me. This area will change and you can enter the cadence that you saw as you were tapping in this area. And then you would, if you could click one more time for me. Once you have the cadence entered in, you could press play and you'll hear the metronome beep at the beat that you asked for. So then as you're walking, you can practice stepping to that beat, and that will help you make sure that you don't slow down as you keep walking. Now, if your goal is to maybe even make an improvement in your walking speed, you could try adding a few beats per minute to this, up to about 10% at a time. So you would want to take that cadence at your comfortable pace and then try to increase it a little bit. For an example, maybe someone walks comfortably at around 90 or 92 steps per minute. Then they could enter 100 into the tempo as their goal pace, and they could try to walk at 100 steps per minute when they're out for their walk. And a lot of times we'll maybe start someone around 100 to 115 steps per minute, and then try to gradually increase it as they get stronger and faster. Sometimes people can walk as high as up to like 120 steps per minute. Keep in mind, if you're walking indoors because of the pandemic or bad weather, you probably want to start, under 100 steps per minute, just because it's hard to walk fast in a confined hallway. You want to pick a pace that feels brisk, but that you can realistically maintain for your whole walk, without putting yourself at risk for overexertion or more importantly, a fall. So make sure you're staying safe at that walking pace as you do it. If you're not sure at all, it's best to just meet with a physical therapist. Maybe we can meet a few times and just go over this together to figure out what your magic number might be. Because there really isn't one number that I can tell you right now. It's a little different for every client that I have. Another thing, if this metronome seems really complicated, another thing you can think of that might be a little easier is just to walk to music. And again, the idea is just for you to pick songs that will help you keep a pace that's a little bit faster, but still doable and still safe. So just make sure when you're walking to music, that you're picking songs that are kind of hitting that sweet spot. If we could advance to the next slide, please. Another thing to think about is just where you should walk. And where you would walk depends on what benefits you'd like from walking. So we all walk for different reasons, but if you are trying to get a little bit better exercise out of your walking routine, I really would encourage you that walking at that brisk pace tends to be easiest on a flat surface. A lot of towns around here have those really uneven sidewalks, those beautiful old cobblestones, or maybe the pavement squares are off and there are big gaps that you'd have to step over. You know, you really can't walk at a fast pace over those uneven surfaces just because of how much you have to really concentrate on where you're putting your feet. So many public schools allow the community to use their tracks outside of their normal school or sports practice hours, or maybe there's a trail that's pretty flat and well maintained. Those might be better areas to try walking at the faster pace. Hopefully, just while we talk, you can think of a nice area in your town that might work well for you. I'd love to see if you have any suggestions that you think of, if you could leave them in the chat. I'd love to see what you're thinking as we talk about this. And if we could head to the next slide, please, Teresa. So now just a few more tips to maximize the benefits from your walking program. One thing I encourage is just to try to avoid multitasking, and that'll help, especially if you think about how you're really trying to concentrate on taking your longer steps or keeping good posture while you walk. If you're getting distracted by different things, that's going to make it a lot harder for you to maintain that best walking pattern that we're working on. So common examples of distractions are just, maybe think about if you're having to walk through a crowd and you're having to change where you're walking just to avoid other people. Or you can also think of having a complex conversation with your walking partner. Those are things that you're not going to be able to concentrate on your walking pattern as much if those are happening while you walk. I would say too, to be careful about how you decide what you should choose to focus on when you're trying to walk. I suggest kind of prioritizing one or two things. Most people will find they might have trouble focusing on their arm swing, focusing on their posture, focusing on their big steps. I kind of tell people, like, if you're focusing on three things, you might not really be focusing on any one of them. So if you're having trouble just deciding what's the most important thing, what's the most helpful thing to concentrate on, I would recommend meeting with a physical therapist. Again, we can give you a personalized recommendation. A lot of times what I try to do is pair a metronome that you don't have to think about as much, will help you keep a consistent pace. And then, a lot of times I'm asking people to concentrate on maybe one other thing while they walk. Another thing, and I know we'll talk about this later on today, so I don't want to get into it too much right now, but just really think about making this a habit. Trying to schedule a regular time in your day would help you. And it's best to make sure too that when you're trying to pick what time of day that you're going to go out for your walk, you want to pick times where your medication is working well, and that you can really do your best and move your best. So I hope that today I've given you plenty of motivation to work walking into your exercise program. And I hope that these tips can give you some ideas of where to start. But if you have any questions or need help getting started, please do schedule an appointment with a physical therapist who can guide you through the process. With that, if we could advance to the next slide. And Teresa, I have to introduce you next. So if I can hand this over to Teresa, I'll let you take it away from here.
Tim, thank you. Thank you so much for the wonderful talk. And hello, everyone. My name is Teresa. I'm another physical therapist in the Center for Neurorehab at Boston University, along with Tim and along with Tami. And today I'm going to cover a piece of our walking topic about intensity. And I know we're talking about walking today, so we'll talk about intensity in terms of walking, but also in terms of overall exercise. So in general, what is exercise intensity? Well, it's the amount of energy expended during any activity. In other common terms, we could talk about this as how hard you're working during exercise. Intensity can also be measured in terms of the amount of oxygen that's consumed during an activity. But in general, we could kind of keep that framework of how hard you're working during exercise as our kind of general definition of intensity. So in general, what's happening during aerobic exercise, which is maybe another general term that you might talk about when it comes to intensity? Aerobic exercise meaning exercise where oxygen is being consumed. So in general, when someone's exercising with increased intensity, in general, someone's typically moving kind of the large muscles in arms and legs, and the body responds by breathing faster and more deeply. And that maximizes the amount of oxygen in the blood. And the heart is beating faster, which increases blood flow back to the muscles, back to the heart, to the lungs, and also increased blood flow to the brain. And in the brain, with this increased blood flow, and we're talking about when this is happening with aerobic exercise or with the kind of skill-based practice that Tim was talking about, with the attention to the quality of walking. With that type of exercise, skill-based practice or aerobic exercise, we know that there's increased blood flow to the brain. And with the increased blood flow, we see an increase in proteins called neurotrophic factors, which also help the nerves communicate better. From some animal studies, we can see animals where Parkinson's was induced, the animals that were exercising with more intensity, we can see that more dopamine was available and the dopamine signals seem to be stronger. So we believe exercise is influencing some structural changes in the brain. And in humans, what we can surmise is that these structural changes may have influence on behavior in terms of overall fitness, function, mood, fatigue. So we hypothesize, and we have growing evidence to support this in animal work, that exercise intensity creates changes within the brain that we can see as behavior. So we believe that exercise intensity is important, particularly so for people who have Parkinson's disease. So if exercise intensity is important, how to measure it or even become aware of it? Well, there's perhaps two overall kind of main ways to measure exercise intensity. One is heart rate, and that's how many times the heart is beating in a minute. And the other is how someone feels when they're doing exercise. So we'll take heart rate first. So in general, this is just one way to measure intensity, but often there's many different formulas about how to measure intensity based off heart rate. A very common one is to get an overall number of what someone's maximum heart rate is. Again, many different formulas to calculate this. I'll just share one example. Very general formula is to take the number 220 and subtract someone's age. So I'll give you an example. If someone is 70 years old, 220 minus 70 gives 150 beats a minute as a maximum heart rate. And then what's commonly done is a percentage of the maximum is taken. And the idea of moderate level exercise intensity, generally speaking, about 60 to 65% of someone's maximum. So this gives, in this particular example, say an idea of around 98 beats a minute for this particular person. However, I'll say this, sometimes heart rate is not the most accurate measure of exercise intensity. For some people with Parkinson's, the Parkinson's affects how their heart rate responds. And sometimes it's not elevating in the same way we might expect. Some people are taking certain medications that blunt heart rate response. So in general, although heart rate is one way to measure exercise intensity, what we actually recommend is people are basing exercise intensity off of how they feel. And I can give you some other examples that we commonly recommend of what I mean by this. So in general, say if you're considering how you feel with exercise, when exercise is starting to become more intense, people may feel like they're breathing harder as they're working, may feel like you're starting to sweat. We also use something commonly called the talk test. And what I mean by that is moderate level intensity is what we believe is sort of ideal in terms of exercise intensity. If someone's exercising at a moderate level of intensity, you should still be able to talk, to carry on a conversation, but you wouldn't have enough breath to sing. If someone was exercising at a higher level of intensity, they might not be able to carry on a conversation, probably only get a few words out. Another way to measure intensity based on how you feel is a scale what we call, or that perhaps you've heard of, called perceived exertion. This is someone's own perception of how they feel. Again, there's a number of different scales out there, but one that we commonly recommend is a number scale. It starts at 1 and it goes to 10. So on this scale, 1 and the low numbers are representing something that's very easy, like you're at rest or you're sitting, up to level 10, which is representing sort of the highest level of exertion that you can imagine. So on a scale of 1 to 10, you almost think to yourself, what number would I give myself based on how I feel with this exercise? Now, on this exercise scale, moderate intensity, which is what we're recommending, is say about a 5 or 6 on a scale of 1 to 10. So I give that to people as kind of a concept to try to a little bit assess how they're feeling as they're exercising, and then think of ways to safely increase intensity to get up to about a 5 or a 6. So I just want to share some research evidence that kind of gives us our support of why we're recommending these kind of things and what we're basing this off of. So I want to share one particular study with everyone. And this was a study called the SPARKS study, which is an acronym for the study of study in Parkinson's disease of exercise. This was a study that included a number of people in the more early stage of Parkinson's. So they were between 40 and 80, again, in the early stage. And what was key in this particular study is that the people involved had not started taking any dopamine replacement medication. So they took this larger group of people and they randomly assigned people into 3 different categories. And one was a usual care. So people did whatever kind of activity was typical for them. Another group was this moderate intensity group. And the exercise in this particular study was walking on the treadmill, and they kept that the same. So this particular group of moderate intensity exercised at a moderate, in this case, they did use the heart rate to determine moderate. And then they had another group that was exercising at a higher level intensity, so a higher percentage of the maximum heart rate. And again, this was a group of people who were walking on the treadmill. And what they did was they recommended people were walking for 30 minutes in the intensity zone. So what in reality, what it looked like was about 5 minutes of warm up, 30 minutes at whatever intensity group they were assigned to, and then 5 minutes of cool down. And they recommended that people were walking on their treadmill for 4 days a week. But in reality, it ended up about 3 days a week. So these the 2 groups on the treadmill were people who walked 30 minutes at the intensity level they were assigned 3 days a week in the average. And what they found was a slower progression of the test that maybe is commonly done in the neurologist's office. Perhaps you've done the one with the neurologist where you're trying to do hand movements and leg movements and walk. You're almost, they usually ask you to move in a big and a fast manner. So that test is one of the ones that they use as kind of the outcome of the research study. And they found less progression in the moderate and the high intensity group. So what they determined was that it was feasible for people with Parkinson's disease to exercise at this moderate and high level intensity group. And they determined that both were good. A question that is really pending is, although both were good, was there any additive benefit on the Parkinson's motor symptoms for people in this higher level intensity group? And that's something we don't yet know the answer to. That's actually the subject of a new national national-wide research study that's being led by Dr. Daniel Korkos at Northwestern University. It's kind of the next study based on the results of this study. So we don't yet know the answer to this higher level intensity, but we do have excellent support that it's feasible for people with Parkinson's to exercise at the moderate intensity and perhaps the higher intensity as well. So when it comes to exercise intensity in a walking program, a common question that we get often from our patients is, what are some ways someone might ask for me to get more walking intensity within my walking program? And often what we'll tell people is, start with what's typical for you. Intensity is always going to be based on the person's perception. So perhaps you're just getting out there, as Tim mentioned, the spring is turning, and perhaps you haven't been out there in a while. So maybe perhaps start with what's already typical for you with your walking program. And then assess how you feel. Could you use that scale, perhaps on the 1 to 10 scale, and see, based on what's typical for you, where would you rate yourself? And then could you consider gradually progressing in a safe manner, progressing perhaps in terms of speed, if this is safe for you? Could you try, say, short intervals of walking a little faster, say from this tree to the next tree, or if you're on a track, perhaps down the straightaway? Of course, these are just given hypothetical examples, and it's important that safety is kind of the top priority. Another way to perhaps progress intensity is to try to walk farther. And again, that to be done in a safe manner. And then this is just as Tim said, if it seems like it's not clear to you how to progress intensity for your program, we highly suggest that you connect with a physical therapist for an individual assessment, especially related to what would be safe ways for you to progress intensity with your walking program. I will also say another question that we get from people commonly is, what if walking is not the best way for someone to progress their exercise intensity? And a couple of very common questions that come up along these lines are, if someone has concern for their balance, or in general concern for their safety, walking may not be the best exercise for them to progress their intensity. The other thing, as Tim was mentioning, that it is very difficult to multitask with a walking program. So sometimes people the priority is to be very dedicated and focused on their walking quality. So they perhaps can't prioritize intensity on top of quality. So these are some examples of when perhaps the walking program may not be the best way to increase exercise intensity. So then some other things that we commonly recommend are, consider a more kind of a seated based exercise program. So seated cycling or other seated exercises. And then again, kind of coming back to connecting with a physical therapist for an individual assessment to maybe determine what exercise style would be the best way for you to progress your exercise intensity. And along those lines, I'd just like to share a little more of the research evidence that kind of supports our understanding about intensity. This was another study. It was called the Park and Shape trial. And this was an exercise study that was done in people's homes. And what they did was they took everyone involved in the study and they randomized them into two groups. One group was doing stationary cycling, so at home on a stationary cycle. And the other group was in a more stretching and relaxation based program. Both groups worked on their program for 30 minutes, 3 times a week. And both groups had the advantage of a kind of a coaching system. So they were using a style of connecting with a coach and then connecting with on a tablet, where they almost had like a game aspect of their program that to kind of build motivation. So both groups had the coach, both groups had the motivation, but they were different in what they were doing. And the cycling group was getting at a certain level of exercise intensity. And then what they found was that only the group that was doing the cycling had improvements in physical fitness and had improvements on that motor measure that the neurologist would do. So it gives us a lot of support it gives us support in our thinking that it's the intensity of the exercise or the activity that matters more than perhaps what activity is going on. So for people that perhaps walking may not be the best activity to progress intensity, it's great to know that the evidence supports you have a choice of what exercise would sort of be the safest for you, what you might enjoy, but kind of a take-home message when it comes to exercise intensity. In general, if we had to say what to do, walking, which I know is our primary topic today, or other aerobic exercise, which is safe and enjoyable for you. What intensity? The research really supports people with Parkinson's exercising at least at moderate intensity. The jury's out on the higher level intensity, but at least the moderate level intensity. And again, what do we mean by moderate? In general, should be able to still carry on a conversation, but not sing. If you had to rate yourself on that 1 to 10 scale about how hard you're working, you want to be at about a 5 or 6, perhaps be out of breath, perhaps be sweating. The idea that you're working somewhat hard, and that's the moderate level intensity. How often to do this? The research suggests 30 minutes at that intensity level at least 3 days a week. And then how to get started? Well, start with what you can do now and perhaps work up towards these goals. And actually, I do want to turn the program over and introduce Tami DeAngelis to cover how to stick with your exercise routine and some suggestions and tips for motivation and consistency. So I'm going to turn the program over to Tami.
Great. Thank you so much, Teresa. That was great. Really helpful information. Okay, I'll get started. My next slide. So what I wanted to talk a little bit about is this gap that many experience between the knowledge and their understanding of the benefits of exercise, and then putting that into action and actually regularly participating in an exercise program over the long term. So Teresa and Tim gave us some great information about getting started on a walking program and finding that intensity so you get the most benefit out of your time exercising. And many of you probably came to this talk with some knowledge. I think we can call it common knowledge that exercise is good for us. And in particular, people with Parkinson's are often encouraged to exercise by their neurologist or family members. But we do know that just by getting a Fitbit from a well-intentioned daughter for your birthday doesn't necessarily translate into 10,000 steps a day, and just wanting and knowing how much it can help you doesn't also always translate. So I want to talk a little bit about some strategies to help bridge this gap that many people experience. It's also important to note that feeling bad does not generally motivate or encourage these types of exercise behaviors. So there's a lot of research around our thoughts and our and actually feelings around exercise and feeling confident about being able to exercise. That can also play a role. So I'll talk a little bit about that as well. Next slide, please. Great. So people talk a lot about motivation to exercise, and the trouble with motivation is that it's a finite resource. So we might start the morning feeling very motivated to exercise, but the day gets in the way and the motivation wanes throughout the day. The other, the other scenario is that you start out the new year very motivated. Many people start out a time period very motivated, and over months that may wane. So motivation is tough, and it also has specific issues in people with Parkinson's, because there's actually part of the disease process affects part of the brain and the pathways in the brain that involve effort and motivation. So many people with Parkinson's might be experiencing apathy or impaired motivation, and it's actually part of the disease process. So I mean, humans in general have often have a very difficult time motivating. We live in a sedentary world with a lot of technology. A lot of jobs are now sedentary, so it can be hard in and of itself. And Parkinson's does add some extra challenge to that. So we can't solely rely on motivation. So next slide, to help bridge that gap. So what I would suggest, in the absence of motivation, we can try to focus more on creating habits and routines. And Tim mentioned this as well. in terms of a walking program. So developing habits and routines are a great way to help not rely so much on motivation. And so we all have habits, positive, negative, neutral. As humans, we have tons of habits. If you stop to sort of think about them and acknowledge your habits, it's actually the first step in trying to develop some habits around exercise. We do things every day like brushing our teeth, walking the dog in the morning, snacking while watching TV. So there's all sorts of habits, and we can capitalize on the knowledge of these habits and when wanting to create some exercise habits. So today, since we're talking mostly about walking, one of the suggestions we have is to stack habits. So adding on to a habit that you might already have and couple that with walking. So for example, if every Monday, Wednesday, and Friday you go to Dunkin' Donuts to get yourself a coffee, in addition to that habit, you could leave 30 minutes earlier, stop at a local track, and walk briskly for 20 minutes, and then go get your coffee. So you take a well-established habit that you already have that's pleasant and enjoyable, and you add the exercise onto that habit. So that's just an example of stacking habits. You can also replace maybe a less desirable habit. So if you get up in the morning and the first thing you do is go to your computer or look at your phone and kind of scroll through the internet, sort of checking your email when it maybe isn't necessarily necessary. Instead of doing that, you could put your sneakers by your computer, and rather than sort of use that time before breakfast to look on your computer or your phone, you could use that time to take a walk. So you would go outside, you would walk into where your computer's located and stick your sneakers on and then go out and leave the house. So that would be a way you could possibly replace one habit with another habit that was more beneficial or promoted a healthier lifestyle. So the next step in trying to create habits and routines around physical activity and exercise would be to make a plan. So this is where we talk about our SMART goals. So we want to make a plan that has goals that are specific. SMART is an acronym for specific, measurable, achievable, relevant, and time-bound. So rather than just saying, you know what, I'm going to start exercising, I'm going to go for a run every day, it's much more helpful to make those goals specific. So I'm going to start working towards walking 10 minutes 3 times a week. I'm going to put it on my calendar, and I'm going to do this over the next 2 weeks. So making a very specific plan is very helpful in helping you execute and stick with that plan. And certainly writing it out on a calendar and putting it down on paper, or putting it using your technology, a smartphone, or a calendar app to document that plan is always also helpful. And then the next thing would be to consider your unhelpful thoughts. So when we start to look at behaviors or choices to not exercise, you can often see patterns of thinking that contribute to the choice to not exercise. And this is very common, that if you look, and the common one we hear about is someone who had planned to go to the gym, and then they wake up in the morning and they lie in bed and they say, would it be better off just pressing the snooze button and getting an extra half hour of sleep? And how much is that really going to help me? And so just as habits can be automatic, thinking sometimes can be also automatic. So these automatic thoughts are important to recognize, especially if they're leading you to not exercise. And we can replace those thoughts. So if you catch yourself having a thought that discourages you from sticking to your healthy habits or your goals that you've established, it's helpful to replace it with a different thought. So as you're lying in bed and you notice that thought, that is this really going to make that big of a difference if I get up and go to the gym now? Maybe replacing it with, I'm going to feel better this afternoon if I go now. So this will be something that in my future self will thank my current self for. So that's a area that is been really helpful in terms of guiding people. As physical therapists, we're really trying to work on changing behavior, and our thinking process around certain behaviors is very critical to that. And the last point on this sort of creating habits and routines idea is that we want to think about the future. And I'll talk a little bit more about how to conceptualize that and really think about what you value and what's important to you. But it's helpful to, when we are very trained to think about the moment, and in that moment you may decide that I'm not going to exercise or I'm not going to stick to my plan. When that happens, it's helpful to sort of ground yourself in the original reason, or a bigger picture reason that this is important to you. So something that guided you to want to do exercise in the first place. So, being an active part of your family, or being an active part of your friends, or participating in a sport. So all those things are what your future self would like to achieve. And so while it's easy to say in the moment that you don't want to exercise, it's important to try to ground yourself in what you want for your future. The next slide. So one of the things that I talked about is making a plan and getting written down on paper. And that's important as well, because it's one of the ways to help give you feedback. And getting feedback on your goals and your progress is a really wonderful way to help stay on track. So using a simple paper and pen document, checking off when you've done your exercise, writing down when you've done your exercise, or choosing to go a more technology route with a Fitbit or a smart watch and a tracking app, or any of those. They're all ways, and really just all very effective in seeing your accomplishments and your progress towards your goals. They're also helpful if we reflect back on those SMART goals. Sometimes you need to adjust the goals. So if you set out with a goal that is not achievable, so the A in that SMART acronym, you can step back and say, okay, so maybe this week I'm going to step back a little bit and see what is challenging for me but achievable, because that's very important. So getting feedback on your goals can help you stick to the plan. Next slide. And making it rewarding. So having rewards is very helpful, especially, this is again back when if we're feeling low in motivation, or motivation is an issue. Having something to look forward to, or something that's meaningful to you. So the ultimate reward that we hope that people who are exercising achieve is feeling great afterwards. That makes things really easy. But if that doesn't come, or possibly a lot of people have difficulty with exercise, sometimes it can be uncomfortable or painful, then having a different reward system, it can be as simple as treating yourself to something afterwards, or just having a celebration of some sort to acknowledge the accomplishment of meeting your goals that week. So anything that will help keep you motivated and make you feel proud of yourself for participating and sticking to your exercise program is helpful. Next slide. And support. So support is a key factor in helping you achieve your goals, and it can help with creating habits, and it can also help when your motivation is low. So some of the ways we can do this through technology. So having friends through apps like on Fitbit who can see your progress walking, having walking buddies. So having someone that you take a walk with 3 times a week in the neighborhood. And many of this is remote, much of this is remote now, but having a remote or virtual class that you see the same people. And then when hopefully we're back to in-person classes someday, having that interaction of someone noticing you're there or not can be very helpful to some people in terms of support and encouragement. And also physical therapists are there to support you. Teresa, Tim, and I often find we're trying to convince people that when you come to us and we set up a good exercise program and we help you create some habits around exercise. And then in 3 months, if you have kind of fallen off track or are having difficulty, a lot of people will cancel their follow-up appointment with us when actually that's the time we want you to come in the most. We know that there's so many challenges to sticking with an exercise program. And that's when we want to come in and, we are here to help people, as are your exercise professionals in the community, to help you get back on track, reestablish routines. It's totally normal to have, especially in the times that we're going through, there are some challenges to sticking to an exercise program. So your physical therapist can be there as a support, your family, your community, reach out, and that can be very critical in keeping you on track. The next slide. So bridging the gap. So I hope that I have given you some ideas here in terms of getting that gap bridged between the knowledge of the exercise and the regular participation in an exercise program. And this is the key factors in this are developing some exercise habits, making a plan, thinking about what you value, what is important to you as a person, so that you can keep that in mind when you're lacking motivation. And these are the tools that can bridge this gap and will be there for you when you're not feeling like exercising, which naturally happens. Hopefully over time though, exercise becomes both a habit and something that you feel like you can't live without. Your day is better when you exercise. And that's ultimately, a goal for participating in exercise. And that ends up being the best type of motivation when you feel better for doing it. And when you're not doing it to feel good, you have the tools you're not feeling up to it, you have the tools to draw on to get back there. So next slide. I don't know if I have going back, this is a little out of order, but overall, one of the most important things is that you're keeping in mind what is important to you. What do you value as a person? If you can have an overarching goal, like being able to be physically able and fit to go to travel with family, to get on the floor with grandchildren, to continue to provide for your family through a job. These are all things that make you, and having living a healthy lifestyle almost always supports this overarching goal and can help people stay on track. Next slide. So if you have any questions we will do our Q&A now, but if you want to get in touch with us, we have some exciting research projects going on at our center, and we also have clinical care. We're here to help you if you would like to start an exercise program. So feel free to reach out to work with if you have questions with Tim, Teresa, or I. And then right now I'm going to invite Teresa and Tim back, and we're going to do our Q&A.
Hello. So I was able to monitor the questions as they came in, and I definitely want to make sure everyone knows it's not too late to submit your questions. So if you think of anything to follow up with anything that we've said so far, or as the questions come up, please do feel free to send your questions in. I wanted to start off with one question that came up. I think it was in reference to my part of the talk. We had two similar questions come in about just what's the best way of finding out what music you should walk to. So again, one of the things you could think about is something that's a little bit faster than your natural pace. And if you kind of can count out your steps per minute, you can know what that cadence would be, and you can pick something that's, at that pace or a little bit faster. So one of the things that we had suggested in the chat was a website called jog.fm, or even just simply Google searching, songs at, 110 beats per minute. So you could work that way to find a few ideas. The other thing is, if you have a few songs that you like exercising to anyways, or you find motivating, maybe you can search what the BPM of those songs are. And you'll find, the numbers might be a little bit off depending on what website you're looking at, but you can at least get in the right neighborhood as you do that. So I think that would be my best suggestion for that. But I definitely think music is a great way, because the metronome can be a little bit hard to manage. So music is a great way to keep yourself on pace, and it's a little easier to pull up for many of us. So definitely give that a try. So another question that we had was, what is the best shoe for Parkinson's disease for walking? I didn't want to capitalize on the Q&A, so maybe I can hand that over. Teresa, do you want to take that one?
Yeah, so I want to preface that we don't have a perfect answer. I will say this is general, but a shoe that's well fit and that's also tied secure on the foot. So definitely don't prefer something where people slide into it. Sometimes I've had people take that type of shoe because it's easier for them to get that shoe on and off, but you want something that has a kind of a closed heel, something you can tie or that's secure around you. And then one of the other things I recommend against is sometimes shoes are marketed to help with balance, and sometimes they have kind of like a rocker feature to it. I have found that those shoes can actually almost challenge balance a little bit more. So something that's well fit, something that's doesn't have a rocker inside of it, something that's comfortable. Those would be some of my general recommendations. I don't think there's been an established best shoe for people with Parkinson's, but again, it's something if someone was connected with a physical therapist, you might just have a chance to kind of individually look at someone's feet and give individual suggestions. I might offer that too.
Yeah, I'm glad you brought that up because I think you're right. We're never really going to know what the one best shoe is because everyone's so different, and like you might have a problem with your foot where you need a lot of arch support. Whereas, like you mentioned, Teresa, some of these shoes that have a really bulky heel to it can actually make people a little scuff their feet a little bit more or become a little bit more off balance. So it's just such an individualized call that we would have to make after seeing you in person. Another question that came in, and Tammy, maybe I should have you start with this one, is when should I stretch, before or after an exercise session?
That's a great question. Sometimes it depends on the stretch, but I think for the most part, people with Parkinson's, because of some of the stiffness or rigidity in the muscles, I think doing a little bit of activity first to warm up, I think they get more out of the stretch. I think that feeling a little bit loose and less stiff, particularly if you exercise first thing in the morning, I think going for your walk and then stretching afterwards, you get more benefit in terms of addressing shortened muscle length. A bunch of people I work with, we've actually, and this is again sort of customized, but there's a lot of people who feel they benefit from starting their walk and then even using like a tree or a fence to do a little bit of a calf stretch or maybe a little bit of a hamstring stretch during their walk and then proceeding on. For some, that feels really good too.
And then a couple of questions we got from Richard are, what impact does walking have on balance? And in a follow-up question, is there any evidence that hiking is a good way to walk for people with Parkinson's disease? So I think I'd probably want to take the first one and then I'll give the second one away. So what impact does walking have on balance? So I think what you mean by that, Richard, and definitely tell me if I'm interpreting your question wrong, because I want to make sure I answer that. So we know that walking can help people maintain their physical functioning fairly well, but if you do have a specific balance problem, it's probably better to directly address that with balance exercises, sort of in addition to a walking routine. The reason I mention that is just that there are so many different types of balance problems that, you know, you might need some more different specific exercises. So the walking will help more generally speaking, but you might need a couple of other exercises to work on the balance problem, depending on what it is.
And then Tim,
and then,
oh, go ahead.
Oh yeah, go ahead, sorry.
I hope I didn't cut you off. I was going to just talk about the hiking.
Yeah, please do.
And I will say, Richard, I don't have any research studies to support hiking as a good way for people with Parkinson's to walk. Or walking training, but I will say it might get at a little bit of that intensity piece, depending on the style of hiking and how challenging the terrain is. It's always our first priority is safety. So if that kind of thing is really just not safe for someone, then we might not recommend it. But it might be a nice way to challenge intensity and might just feel good. Might also be something that is a little more safe if there was a maybe hiking pole. That of course is very individualized, but it's certainly we feel the best exercise is the one someone enjoys and the one that they'll be able to do. So if hiking is really kind of covering those two ideas, then we strongly support it.
All right, so I think Bill, if you wanted to pull back in, I think that's all the time that we have for today, but I just definitely wanted to thank you for having us. Oh, Bill, you're on mute.
Fantastic job, everybody. Thank you. This is the exercise and physical therapy all-stars within the PD community. And so I want to thank Tami, Tim, and Teresa for their presentation today. As I said earlier, this is going to be recorded. We'll get it up on YouTube and we'll distribute it to everybody. Just a few additional things. We have Optimism Walk that's planned here in Massachusetts. It's virtual. It's going to be delivered on May 22nd. Everybody can attend, regardless of where you live, including people from all over the country. So we'd love for you to participate in that. The funds used or the funds collected from this event actually go to help us do these great monthly presentations, as well as provide programs and services to the community. We'll be sending out that link as a follow-up. And then next slide, Teresa, please. These are ways to stay in touch with APDA. We're going to have additional programs each month over the course of the next 6 months. And so if there's a way to engage with APDA here in Massachusetts, whether it's Twitter, Facebook, Instagram, or just on our website, please do that. We also have a weekly newsletter. If you'd like to receive that, please reach out to us and we'll make sure that you get that distribution. Thank you. Next slide. And I just want to thank everybody for attending today and thank the staff there at the APDA National Rehabilitation Resource Center at BU and each of the presenters today. Wonderful job, complete information. If you have any additional questions, you can reach out to the APDA Information and Referral Center at 800-651-8466. Thank you and have a great day.